Okay, thanks very much to the Irish Cancer Prevention Network for the opportunity to speak to you today about steps to reduce your cancer risk when it comes to smoking and secondhand smoke. So here's an overview of what I'm going to speak to you about in the next 10 minutes. And first, I'm going to answer the question, is smoking and secondhand smoke still a problem here in Ireland? Well, we might think that our job is done when it comes to tobacco control, because through a series of politically led, high impact strategic policy interventions, like, for example, the smoke-free workplace legislation and the plain packaging legislation that was introduced more recently, we have thankfully seen a reduction in smoking prevalence across the population. And in fact, in 2013, on the foot of this great progress, government set the bold ambition of reducing smoking to minimal levels, smoking prevalence of less than 5% by the year 2025. Our work isn't done because, in fact, in Ireland, there are over 100 deaths each week that are due to smoking and secondhand smoke. So that's more than enough to fill a bus in terms of deaths that are associated with the harms caused by smoking. Again, on a weekly basis, there are around 1,000 hospitalizations across our hospital system that are due to smoking. So just to put a picture on that, that's sufficient to fill St Vincent's Hospital in Dublin or University Hospital Limerick on a daily basis with patients that are there because of smoking-related disease. Smoking also contributes to the wide gap in health that is experienced across population groups here in Ireland. So about 50% of the gap in health between our richest and poorest groups relate to differences in smoking. And actually, the social pattern of smoking has changed in recent years, and we've seen a widening in socioeconomic inequalities in smoking here in Ireland. And while we have, over the last 30 years or so, made good progress in terms of reducing smoking prevalence across the population, in fact, in recent years, we've seen a stalling in terms of the reductions in smoking prevalence here in Ireland. So all in all, we're off track in terms of delivering on government's bold ambition of a tobacco-free Ireland by 2025. So thinking about then the relative contribution of smoking and secondhand smoke to the overall problem of cancer here in Ireland, it's important for us to bear in mind that smoking causes 15 different types of cancer, and secondhand smoke exposure also causes cancer. Globally, when the burden of cancer is examined, we see that across the world, smoking is the leading cause of cancer. And it's the leading cause of cancer by quite a large margin. Almost 2 to 3 times more cancer globally is caused by smoking than any other risk factor. The picture is similar here in Ireland as well. So this is data from a piece of work that was done by the Cancer Registry here in Ireland. And they showed that 13% or 1 in 8 deaths that are due to cancer could be avoided if we eliminated smoking and secondhand smoke here in Ireland. So as you can see here, almost 3,000 deaths each year or cases of cancer were attributable to smoking and secondhand smoke. And as you can see, the number of cases of cancer in Ireland that are attributable to smoking are far in excess of other well-known causes of cancer, for example, overweight and obesity, infection and alcohol intake. So moving on then, one of the new issues that we're faced with in terms of tobacco control is e-cigarette use. And people may be wondering, well, what about e-cigarettes? What does that mean in terms of reducing risk from cancer? Well, the evidence around e-cigarettes was examined in great detail by the Health Research Board, and they recently published a number of reports in this area. And across their reports, firstly, they identified harms associated with e-cigarettes across a number of different domains. In fact, they identified that e-cigarettes in a number of studies were found to contain carcinogens, chemicals that can cause lung, mouth, esophagus and bladder cancer. Next, they found that children who used e-cigarettes who didn't smoke were 3 to 5 times more likely to go on and start smoking than children who didn't use e-cigarettes. And finally, then looking at e-cigarettes in terms of whether or not they helped people to stop smoking, they found that the e-cigarettes were no more effective than approved and regulated nicotine replacement therapies. So when it comes to children and e-cigarettes, there is only harm and no benefit associated with e-cigarettes. So we would strongly urge that children are protected from the harms associated with e-cigarettes. When it comes to adults who currently smoke and the question as to whether or not they should use e-cigarettes as a way to stop smoking, this is a question that we examined in detail through recently published national clinical guidelines in the area of stop smoking. We didn't have confidence in relation to the studies that had been conducted, that they pointed to a clear benefit in terms of e-cigarettes helping people to stop smoking. We also had concerns in terms of the balance of risk and benefits and a number of uncertainties in terms of what the future may bring in terms of people who use e-cigarettes. And we were also concerned about the fact that e-cigarettes are a consumer product. So they're not authorized as a stop smoking medicine, like, for example, nicotine replacement therapy, and they're not regulated by the Health Products Regulatory Authority here in Ireland. And there are some wider considerations as well. So it's very important that we protect children from the harms associated with e-cigarettes. And important for us to bear in mind as well that there are safe and effective alternatives in terms of helping people to stop smoking, which is something I won't come on and speak about. So for people who currently smoke, here in Ireland, we don't recommend that they would use an e-cigarette to make a stop smoking attempt. A number of people do, and we're very happy to welcome those people to our services and work with them in terms of providing behavioural support to make sure that they are successful in their quit attempt. What are the best ways to stop smoking? Well, it's very important for us to bear in mind that most people who smoke are actually very interested in quitting. So most people who smoke aren't happy with their habit. 2 out of 3 will tell us each year that they want to stop smoking, and 1 in 2 will tell us that they had made a quit attempt in the last 12 months. But too many people who smoke make those quit attempts without support. And unfortunately, too many of them, over 7 out of 10, don't experience healthcare professionals in the course of their interactions with healthcare, raising the issue of smoking with them and providing with them with support. So this is something that we sought to address through recently published National Stop Smoking Guidelines. And within those guidelines, we recommend that all healthcare professionals would raise smoking with somebody that's using the service, that they would ask about their smoking behaviour, and if somebody does smoke, that they would give them advice in relation to the harms and recommend that they quit. And those steps alone, which are known as brief intervention, they can double the chances of somebody going on and making a successful quit attempt. Brief intervention then is combined with arranging effective support, and effective support is a combination of behavioural support and a stop smoking medicine, either something like varenicline on its own or with nicotine replacement therapy, or combination nicotine replacement therapy. Then arranging that support, behavioural support and stop smoking medicine, can increase the chances of somebody making a successful quit attempt by 3 to 4-fold. What's next in terms of reducing cancer risk from smoking? Well, we certainly need to double down and implement what we know works in terms of tackling the harms caused by smoking. So we need to make sure that we better implement all the measures that we're currently aware of. We need also to take more targeted approaches, and that's something that we're leading on within the Tobacco Free Ireland programme in terms of working within our Sláinte Care Healthy Community programme areas for people in poorer socioeconomic groups here in Ireland, and delivering tailored stop smoking support to those people as well. We've also been working with colleagues in screening in terms of embedding stop smoking care as part of the end-to-end process of care that somebody experiences when they have cervical screening. And as people are probably also aware, the next thing on the horizon then is the question as to whether or not countries like Ireland should consider implementing routine population-based lung cancer screening for people who have a smoking history or who currently smoke. But I spoke already about the significant burden of cancer cases each year here in Ireland related to smoking. It is the leading cause of cancer. And the government has already committed through its Tobacco Free Ireland programme to trying to eliminate that problem completely. And we in the HSE Tobacco Free Ireland programme, we went out and we asked the public their views on this goal. And we heard from the public that while only 1 in 3 people were aware of government's goal to try and eliminate smoking across the population, actually 3 out of 4 people said that they supported this. And when we looked at a range of different measures that could be implemented here in Ireland to try and achieve that goal of eliminating smoking, we found that there was high support for most of these measures. These included things like introducing a higher age restriction in terms of the retail tobacco products, reducing the nicotine content in nicotine products and tobacco products, and also then phasing out the sale of nicotine and tobacco products here in Ireland. So there was huge support for those measures. So as I've already said, smoking and secondhand smoke are the leading cause of cancer. So we're very pleased with the Tobacco Free Ireland programme to be working with the Irish Cancer Prevention Network in terms of making sure that government stays true in terms of its commitment to trying to eliminate this very significant cause of cancer, and trying to get the seemingly impossible task of eliminating smoking-related cancer done together. Thanks very much.